Hello, this is Katherine Marie, and you're listening to Long COVID Real Talk podcast. I wanted to do a little episode today for my chronic fatigue clinic appointment. Honestly, I'm really grateful to this clinic because there are very few people that take long COVID seriously or seem to understand the full extent of it. And the physician that I had the appointment with is very well known for his work. And I really like him. But for whatever reason, he was having a hard time understanding me. It was frustrating. First, his nurse said that there was something I had to fill out before the appointment. And I went in and there was an inventory, like a fatigue inventory, a questionnaire, and I filled it out. And then I was like, okay, great, I did it. And then I get a call from the nurse saying, you didn't fill out the form. And I was like, yes, I did. And she was like, no, I didn't get it. And I was like, okay. She's like, can I ask you the questions? And I said, yeah, sure. So, and it apparently was like a different thing. Like I'd already checked in. I'd already confirmed my medications and allergies. But she wanted me to take my blood pressure and all that stuff, which is fine. But then when I had the appointment with the physician, he seemed flustered with me because he kept asking me to rate things. And I just have a hard time rating things because the symptoms vary and wax and wane so much. And he ended up holding up the pain scale, like with the smiley faces, and telling me to do that. And I was just like, oh God, this is bad. And he said that my brain fog seemed really bad because he was having a hard time making sense of what I was saying. So I don't know. The whole thing made me feel so bad. Like I just felt like I felt rushed. I felt like my answers weren't what he wanted to hear. I wasn't sure he believed me. And this is someone that's like a really good doctor that like does a lot of work for long COVID. So maybe he was just having a bad day. Or maybe my brain fog really was that bad. But overall, it was a really frustrating appointment, just emotionally. I guess most of the time, appointments are emotionally hard for me. Not always, but they tend to be because I feel really vulnerable. And usually Western medicine doesn't allow a lot of time for appointments. So, especially follow-up appointments. So I think it was a combination of those factors. But he said that I need to sleep more and rest more. And when I rest, to rest more fully. I don't know. It just didn't feel good. I didn't feel like we were a team. It just felt like, I don't know, just not good. And then as far as medications, he changed one of them. So instead of Pepsid or famotidine, 40 milligrams twice a day, it's now 3 times a day. And then he wants me to start Celebrex for the inflammation. I think the arms and legs inflammation, pain, that sort of stuff. And then eventually he said we can increase the Valtrex from 500 twice a day to 1,000 twice a day. So yeah, I don't know. I'm just like, I know I look like hell, and but like this is me. This is me after an appointment in all the long COVID glory. And I really am having a hard time putting things together. So I just wanted to do a little bonus episode for my chronic fatigue clinic appointment, including the medication changes, because I really like to make sure that I keep everyone updated on the medications that I take, because most people don't have a chronic fatigue clinic they can go to. So if you hear things and the symptoms sound the same as what you're having, then you can go to your doctor and be like, hey, is this appropriate for me to take? And it can give you a place to start for trying to treat yourself with the help of a primary care provider, for example. And the disclaimer, as always, please do not just start taking medications that I'm taking. They're almost all prescription medications, so you couldn't if you wanted to, but just make sure that whatever medication changes that you might want to make, that you run them by your primary care provider or your provider for long COVID, whoever is managing everything for you, and just make sure that I lost my train of thought. Sorry. Yeah, just make sure that the doctor, like that you run it by an actual medical provider for your specific needs. So with that, I'm going to leave you, and honestly, I think I'm going to have a piece of chocolate because I'm just feeling like just not good. And I should focus on the fact that I got my medication updated and it's going to be fine. And, the medication has been game changing for me. But almost every appointment that I've had to go through to get a medication adjustment has been just very unpleasant and very difficult to go through. I hate appointments. I hate them. And it's a shame because I used to be the person that would do appointments myself, right? Okay, so that's it for now. Thank you for listening, and we'll talk again real soon. Okay, take care. Bye.